Hello again, class, and welcome to Chapter 9 of Sedative Hypnotic Drugs. Sedative hypnotic drugs derive their name from their relaxing, calming effect they produce in low doses, and sleeping and hypnotic effect they have when taken in high doses. These drugs are considered central nervous system depressants, and they overall slow down most of the body's functions. Some people erroneously believe that they have a stimulating effect because people tend to become less inhibited after ingesting these substances, but that's usually because it uh, inhibits the control centers of the brain that leads to somewhat uh, unruly behavior. There are three main types of sedative hypnotics. There are the traditional barbiturates, um, there are non-barbiturates, and then minor tranquilizers. They all have different effects and at different doses. And you see, the one thing that all of these types of drugs have in common is that they, like I said before, they are central nervous system depressants. Some have legitimate medical indications, and some are used for more illicit purposes, which we'll discuss in a few minutes as well. The oldest of these type of drugs are the barbiturate class, which are, again, central nervous system depressants. Their effects range from mild sedation to total anesthesia. They're prescribed as anti-anxiety medications, hypnotics, and even anticonvulsants to treat seizures. They can be classified as ultra short acting less than 4 hours, intermediate acting from 4 to 6 hours, or long acting more than 6 hours. Their effects include depressing the central nervous system, decreasing heart rate, decreasing respiration. That's the problem with overdose of these medications. They can result in asphyxia and suffocation. Their effects are very similar to that of alcohol. They work on the same neurotransmitters, GABA, if you remember that from previous lectures. The combination of alcohol and barbiturates is extremely hazardous. Unlike other sedative agents such as the benzodiazepines, there is no reversal agent. If you remember, we talked about overdose of opiates. You can reverse the effects with a medication called Narcan. Barbiturates do not have that property, so overdose on these medications can be very potentially lethal. They're traditionally been used as sleeping agents. However, their effectiveness as sleeping agents is questionable because even though they may initially induce sleep, they tend to interfere with deep sleep and the REM, or rapid eye movement sleep. And users may experience a rebound insomnia, or they may wake up feeling groggy and not well rested. They were the first medications used for anxiety. And they're still used today. They do have, like I said, very legitimate medical purposes. Nembutal, for example, is used to induce anesthesia in surgical procedures. Phenobarbital is used to treat seizures and epilepsy, both in the chronic and the acute stages. So there is an indication for these medications. Shortly after barbiturates were introduced and marketed in around the 1860s, a number of non-barbiturate sedatives were invented and put on the market with depressant effects. And again, increased sedation while reducing anxiety. Most of these medications have been taken off the market, or they're very rarely used today, because other drugs have been shown to be more effective and a lot safer. Chloral hydrate was discovered in 1832 and was one of the earliest non-alcoholic sedatives produced. It was widely used for sedation in asylums and in general medical practice. It also became a popular drug of abuse in the late 19th century. If you're a fan of the old 1940s detective movies, you might be familiar with the term slip 'em a Mickey, which meant putting chloral hydrate drops in somebody's drink to render them unconscious, or basically give them knockout drops. Although previously indicated for the treatment of insomnia, it's been largely replaced by newer, safer alternatives. There's still some off-label use for it in medicine as a sedation agent, especially for small children who are undergoing medical procedures which require mild sedation. Paraldehyde was introduced into clinical practice in the United Kingdom in 1882, and then worked its way over into the United States shortly thereafter. It's a central nervous system depressant and was soon found to be an effective anticonvulsant, hypnotic, and sedative. It was included in some cough medicines as an expectorant, though there is no known mechanism for the reason why this happens beyond the placebo effect. You remember the whole introduction and problems with patent medicines. It's commonly used to induce sleep in sufferers from delirium tremens or people who go through severe life-threatening alcohol withdrawal, but that's been replaced by other drugs in this regard. It's one of the safest hypnotics and was regularly given at bedtime in psychiatric hospitals and geriatric wards up until the 1970s. The only problem with this medication is up to 30% of the dose is excreted via the lungs and the rest through the liver. This contributes to the real horrible breath odor that's associated with ingestion of this product. Bromides were discovered during the second half of the 19th century and found to have a calming effect on the central nervous system. By the end of the century, they were widely used both for specific indications like epilepsy, convulsions, and insomnia, and even for just general nervousness, which we would consider today as general anxiety disorder. Sodium bromide was used in remedies such as bromoseltzer that was popular headache for hangovers, in part due to the sedative effects. Use of bromide medications is pretty much limited today due to highly toxic side effects such as neurologic and pulmonary damage. Meprobamate, or what was commonly known as Miltown, was one of the first drugs to be widely advertised in the general public. Old-time comedian Milton Berle promoted this drug heavily on his television show, sometimes even calling himself Uncle Miltown. Miltown became ubiquitous in the 1950s American life, with about 1 in 20 Americans having used it by late 1956. As a matter of fact, the song Mother's Little Helper, written by the Rolling Stones and Mick Jagger, was a response to the criticism that they faced for the drug culture, citing that everyday general housewives and ordinary people were constantly addicted to these drugs and they were being somewhat hypocritical. Now, there's something interesting in your textbook. If you look on page, 180, it mentions that popular movie star and martial artist Bruce Lee died of an allergic effect from a medication that contained meprobamate, something called Equagesic, which was a combination of meprobamate and aspirin. Now, I've been a major Bruce Lee fan for almost 40 years. I've read a lot of books, watched a lot of documentaries, and I have to go into conflict with this citation in the textbook. It was never actually proven his cause of death. Most people, there's so many conspiracy theories that went on at this time, that it was the Chinese mafia that offed him, that it was a family curse, and other things as well. It was more likely he had a brain aneurysm. That was my opinion, but I just wanted to get that off my chest, is that it was never actually proven that it was an allergic reaction to this medication. With that being said, let's move on. Methaqualone, or otherwise known as Quaaludes, were originally developed to treat malaria and Tests and experiments in India found that to be somewhat ineffective. They were developed around mid-1960s, and they were marketed to relieve tension, anxiety, and promote sleep. And one of the benefits of these medications is that they didn't have the hangover effect that traditional barbiturates would leave you with. So this became a very popular recreational drug. It affects it lowers inhibitions, feels anesthetized, induces memory loss. So this was one of your original popular, thought to be, I wouldn't say necessarily date rape drugs, but drugs that were thought to enhance somebody's sexual desire. Um, However, most of the studies shown that even though it decreased ambitions, it did nothing to increase libido or sexual performance. And if you're all know in popular media, the popular longtime comedian Bill Cosby, who was convicted of sex abuse charges, readily admitted to giving female guests quaaludes to facilitate sexual encounters back in the 70s. That being said, these drugs are no longer produced, at least legally in this country, anymore. They've been put on the Schedule 1 list of banned substances. Benzodiazepines, such as Valium, for example, are minor tranquilizers that were first developed in the 50s and became quite popular in the 60s and are the leading brand of medications prescribed for anxiety disorders. They're very well known of these brands include Xanax, Ativan, Klonopin, Librium, as well as many others. Um, they are safer sedatives than are the barbiturates, although still with some side effects. The effects of these medications can be reversed upon overdose with a drug called flumazenil, although in emergency medicine, we are very cautious to use the reversal agent flumazenil for somebody who is benzodependent, as it can induce seizures and withdrawal symptoms. They're medically indicated for things such as alcohol withdrawal, muscle spasticity, induction of anesthesia, and of course termination of seizures, as well as anxiety. They have a much better safety profile than the traditional barbiturates, although dependency is still an issue. Thing to know about benzodiazepine withdrawal is it can be a very life-threatening situation, similar to alcohol withdrawal, which, the symptoms of anxiety, tachycardia, restlessness, vomiting, headache, seizures, cardiac arrhythmias, and even death. They need to be discontinuation of these medications needs to be done slowly in a tapered format and monitored by medical personnel, usually in an in-house format. And just as mentioned before, you can see all these symptoms, including nausea, insomnia, grand mal seizures includes full convulsive seizures, abnormal body sensations, a condition called formication, where you feel, not fornication, formication, feeling of bugs and other things crawling up your skin, aches and pains, delirium or delusions, detachment from reality, muscle spasms, rebound, anxiety, and finally depression. So it's important to be medically monitored if deciding to come off of these medications. So now, an unfortunate issue to be spoken about regarding the illicit use of some sedative hypnotic drugs is that involving date rape drugs. Circumstances regarding date rape drugs often involves a circumstance in which somebody, and by somebody I do mean either male or female, is out at a party or a club, has a drink, leaves it unattended or unguarded, or has somebody they don't know buy the drink for them, and in the interim, somebody slips a mind-altering chemical to facilitate a sexual assault. Often the victim wakes up hungover, disoriented, feeling as if they had sex, but not remembering the encounter, not remembering the assaulter. The victim may have even experienced more violent effects such as cuts, bruises, and torn clothes. I definitely encourage you to go into your lesson folder and view the video that was posted regarding date rape drugs. Two drugs most commonly involved are rohypnol, otherwise known as roofies, and gamma hydroxybutyrate, or GHB. We'll start talking with rohypnol. It's a sedative hypnotic. It's very related to Valium, but it's 5 to 10 times more powerful. It was originally marketed in Europe as a muscle relaxant. It's odorless and tasteless, and when combined with alcohol, the synergistic effect is much greater than the effect of any of the two alone. It tends to leave the victims disinhibited, helpless, and vulnerable, almost in a zombie-like state. And as I said before, its effects are greatly combined when mixed with alcohol. The other drug is very common in the Lower East Side of Manhattan, and I know that because I used to work in the ER down there. Gamma hydroxybutyrate, otherwise known as GHB, sometimes referred to as liquid ecstasy. It's an odorless, tasteless, and easy to produce. It was a legal substance and popular in health food stores back in the 1980s. There was some thought among bodybuilders that it might help increase the production of human growth hormone, which would facilitate muscle growth. However, that's never been known to be the case, or never been proven, I should say. When combined with alcohol, a person may lose consciousness and memory, and the potential for death escalates when combined with alcohol. And when you see overdoses of GHB, it's kind of interesting for those going into medicine or emergency medicine. A person who's overdosed on GHB tends to present very similar to someone with a narcotics overdose, except their pupils will not be pinpoint. They'll be open. Whereas somebody who's overdosed, or at least unconscious from narcotics or heroin, will, if they don't die, they will slowly ease out of back into consciousness. Somebody who's overdosed on GHB tends to wake up violently, especially if they're induced with any noxious stimuli, like trying to stick a breathing tube down their throat, and they can become very delirious, going into a state of excited delirium, in which case in medicine they have to be resedated and then monitored for several hours. But that being said, the take-home message here is, if you're going out partying, have a good time, but watch your drink. Keep your hand on your drink at all times. Know who's getting you your drink. And if you find yourself a victim in one of these circumstances, God forbid, please take it upon yourself to seek medical care in the emergency room as quickly as possible. Okay, so this is stuff we already went over. So the next drug to talk about, we would consider the poor man's sedative, the poor man's hypnotic, or the younger generation's medication of choice, and those are the inhalants. These are chemicals called halogenated fluorocarbons that are found in a whole host of different products, from whipped cream to furniture polish, to everything you see up there in that slide right there, spray paints. And these halogenated fluorocarbons affect the central nervous system. They affect a lot of other organ systems as well. This was first noted during World War I. There's a consideration that this may be used as a gateway drug because it's most commonly used in adolescents aged 12 to 13 who can't really get access to the other types of drugs on the market. They're available, they're legal, they're in any hardware store, any stop and shop, low cost. There's a strong relationship between inhalant use and other behavioral problems. And so as you can see in the slide here, what generally happens is somebody who knows about these effects will get some paper bags, some tissues, and spray these products into the tissues and do a process of what's called huffing and inhaling the vapors from these products. and getting the type of high and sedation that comes along with these products. As you can see in the upper right slide, you can see someone who has suffered chemical irritation to his face, a telltale sign of his huffing habit. Uh, one thing to note is that with the use of inhalants, a serious complication that comes along with that is something called sudden sniffing death syndrome. I know that sounds dramatic, but what does that mean? Well, these halogenated fluorocarbons greatly enhance the effect of the sympathetic nervous system on the heart and the cardiovascular system. So if you take the scenario of a young kid up in his bedroom, sniffing glue, getting high, mom's wondering why he's being so quiet for a while, comes upstairs, knocks on the door. That knock is perceived by that kid as almost a clap of loud thunder and can actually put the person into a full-blown cardiac arrest. Cardiac arrest that's usually refractory to CPR and defibrillation. So that's always a cause for concern. Long-term effects include frequent nosebleeds, liver and kidney damage, weight loss, depression, and permanent sores around the mouth, nose, and the back of the throat. Toluene is a psychoactive agent found in glue, which can cause immediate cardiorespiratory arrest, lead to physical and emotional damage, and cause brain damage as well. And it's very, very common. Another product to talk about is ether. It's one of the most earliest used anesthetics used in surgery. It was colorless, odorless, initially used to eliminate pain during surgery. Very effective, very short half-life too. It's also used as a solvent in a lot of cleaning products as well. So that's sometimes one of the products that is obtained through the use of hupping. Nitrous oxide, or what's commonly known as laughing gas, is a colorless gas with a sweet taste and odor. And of course, you probably most know it from its use in dental procedures. It provides sedation, pain relief, anxiety relief, and sleep. This has actually, in the past, been used on ambulances in EMS as a means of providing care and comfort to cardiac victims by reducing the workload on the heart. And there's some call to bring it back onto the ambulance. It's kind of a funny situation. There seemed to have been in history in the 70s and 80s when it was a popular standard of care that a lot of these tanks had unexplained leaks and had to go out of service, and nobody could really understand why. In overdoses, though, it can cause a decrease in oxygen levels, resulting in permanent brain damage. So that's some issue to watch out about there. Then there are other medications called nitrite inhalants used for both medical and non-medical purposes. 3 types: amyl nitrate, butyl nitrate, isobutyl. These are found in medications such as amyl nitrate is most popular. It's used to reduce the burden of the cardiovascular system. Side effects include pounding headaches, drop in blood pressure, rapid pulse, loss of consciousness. Most street term for these type of drugs are called poppers. I'm not really sure 100% where they get those names from, but the use of these poppers can result in all the effects that we've talked about, including more. It doesn't seem to be that prevalent these days, but it's still something to watch out for. And the side effects of using poppers include lesions around the nose, lips, increased intraocular pressure, which can lead to blindness, headaches, respiratory reactions as well. So to recap everything we should get out of this week's lesson material: explain the original purpose for which barbiturates were developed, contrast between ultra short-acting, intermediate-acting, long-acting barbiturates, not really that important. Discuss the medical applications of barbiturates and their potential side effects. Define sedative hypnotic drugs and describe the 3 main types. Examine current uses for sedative hypnotic drugs today. Think about why some sleep aids may be very medically important, like in our discussion question talked about. History of methaqualone. Analyze the medical uses of benzodiazepines and their effects. That's important. List the various drugs associated with date rape and their side effects. Inhalants. Know about that. Know a little bit about sudden sniffing death syndrome. Try to look up the prevalence of inhalant use among adolescents and the side effects of these drugs as well. And with that, please have a wonderful week, and we will take it up next time.